News Talk Sports for the Triad WSJS. 6 minutes after 9 o'clock. Welcome to hour number 3 of the big show. I'm Jeffrey Griffin alongside Christian Snyder. It is Medicare Monday on a Medical Monday. Our good buddy John Dunn from HealthTeam Advantage back in the studio. How are you, brother?
Doing great, Jeffrey. Good morning. How are you?
Good morning. I'm glad to have you back. And
glad
this is exciting.
To be back.
So there's a lot to get to. And folks, if you have a question, your healthcare concierge is ready to take your call if you want to give the folks at HealthTeam Advantage a call.
That's right. They're there at 8 o'clock in the morning till 8 o'clock in the evening.
They've already on their second cup of coffee.
They better be, yes.
And the phone number, 336-920-3648. Or you can find them online, healthteamadvantage.com or HTANC.com. Either website will get you there. But, John, right off the bat, before we get into all the different parts and the different colors and the different deadlines and dates and the stuff to think about and the questions to ask, there are some things that are new to Medicare. So let's go ahead and start with that part of the old chip off the block and what is new to Medicare in 2024.
Okay, so 2024, you've had things enacted like the Inflation Reduction Act. Mm-hmm. Insulin dependent could get their insulins capped at $35 a month copay.
Sure.
That's huge for people who are on insulin. Mm-hmm. So that was part of that act that got passed and went into effect. I think for Medicare, that was one of the bigger things. Also in Medicare, your Part B premiums get adjusted each year. So this year they were raised slightly to $164.90 per month for that Part B premium. Mm-hmm. People who are on Medicaid, they don't have to pay that Part B premium. That's taken care of for them. But for everyone else, they know each year to be looking for that rate difference on their Part B. And it's our government that works that out every year. And usually people will get a Social Security increase, but then their Part B premium increase almost washes that out.
Right.
So they get the same amount in their bank account.
It's not an increased burden, but you still need to know.
You still need to know. Yeah. So, those are the two biggest things that affect Medicare.
And those are not local decisions. I mean, you mentioned it, but I don't want to skip over it. This is not, in the conference room at HealthTeam Advantage.
No, those are made at the federal level.
That's a much bigger meeting.
That's right.
So that all just kind of is more of an edict. This is the parameters in which you have to work.
That's it. Yep.
So, all right. So as long as we're all on the same ground and we know where we're starting with.
At HealthTeam Advantage, we have a chronic special needs plans, okay. and it's for people who are either diagnosed with diabetes or congestive heart failure.
All right.
And with those type of plans, you don't follow the enrollment period set. You can enroll in the chronic special needs plan any time of the year.
Is that right?
That is correct.
Okay.
So the enrollment into our special needs plan is continuing all year long. So that's why we're going to talk about it today.
Okay.
And, when we statistically look at the population, not just in the nation, but here locally in the Triad, those diagnosed with diabetes continues to rise year after year after year.
Sure. I mean, it's just not a surprise that it is a part of the American way of life almost now. If it's not you, you probably know somebody or it's in your family.
Can guarantee you at least know somebody with it.
Sure. So it's a conversation that we've all been a part of. We've overheard maybe at the restaurant, at the store, at church.
That's right.
So, or it may just affect you directly, which is also, that's part of it as well, right?
That is exactly right.
And this is open. The enrollment continues because you never know when that diagnosis is going to appear.
That's exactly right.
The doctor's not going to go, I would tell you have diabetes, but I'm going to wait until next January. So if we need to address it.
Or we'll call it pre-diabetes until then.
No, if we need to deal with it, then we need to deal with it.
That's right.
All right.
So that does not mean you only qualify for this plan if you're newly diagnosed or able to enroll. You can enroll in this plan if you've had diabetes for 10, 15, 20 years, or if you're newly diagnosed, either way.
All right. And, and sometimes, John, it's one of those things, too. I've had diabetes. I've heard this conversation. I've had diabetes for years, but I never paid attention to it.
That's right. And that is why, I think it's 5 years ago now we rolled out this plan because we were hearing that even with our other Medicare customers, and it's like, I'm a diabetic, I pay no attention to that. Well, it is very important to pay attention to that because the more you keep that under control.
Sure.
The better quality and the longer life you can expect.
And sometimes there are ramifications of not paying attention, or as my grandmother used to say, I'm not paying that any mind.
That's right.
and all of a sudden you can have a health concern which you never even suspected. I mean, it could be something on the leg, you could have an ulcer on the foot, and then the way that can manifest and explode. And now you're just in a world of, you're with a doctor or a nurse every other day, or so it seems.
That's exactly right. And it's how quickly those things escalate.
Mm-hmm. And we don't want you to be in a place where you're uncomfortable and you got to deal with that. So it's easier, not only for your well-being, your physical well-being, but for your emotional well-being as well, to try to keep that under control on a day-to-day basis.
Yes, absolutely.
And then you have fewer complications, I would think, just inherently, the more attention you pay.
That's right. That's what we see with our customers on this plan, is their quality of life gets better. It's not once you have a program in place and you're used to that program day in and day out, it just becomes routine for you.
All right. So you've got this chronic special needs plan. So is diabetes the only thing that will get you into that plan, or are there some other situations we need to talk about as well?
Currently today, it is diabetes or congestive heart failure, both of those.
Okay.
We know there are more people in our population with diabetes than congestive heart failure, but there are people whose quality of life we are improving who are patients of congestive heart failure.
Sure, and that's another one where the diagnosis, maybe you've had a cough for 6 months.
That one's a little tougher to diagnose.
Right, but you just think it's a cough. And also the doctor says, well, let's sit down and have a conversation. But there are things that medicine and medical care can provide to alleviate a lot lot of that. Mm-hmm. So it's not a sentence.
No, absolutely not.
No, it's something that you got to deal with.
Yes.
Right? Now, that brings on a whole other world of questions, John. And the first thing pops in my mind, we talked about when you're considering, is this the right Medicare Advantage plan for me? You talk about HMO versus PPO.
Right.
Does that play into the chronic special needs plan as well?
It does. And our chronic special needs plans is an HMO product.
Okay.
Meaning you have a network of doctors you need to stay within.
Okay.
And the reason for that is, as a health plan, we have to show CMS, that's the government entity out there overseeing Medicare, that we are diligently working with your doctors to improve your quality of life and your health care. The only way we can manage that is through a network of providers.
So it's a team. It's a team attack.
It is absolutely a team attack, and we don't want people feeling like they're isolated with this health condition. We work with your provider internally at HealthTeam Advantage. We have our own care managers that work with your physician to be sure you are on the best care plan possible. We have a dedicated social worker on staff to help people on this plan because, there's so many things that go along with these chronic conditions, and, just medication cost is one of those, and taking those medications as they are prescribed sometimes can be difficult. Monetarily difficult.
Right.
So we've got an on-staff social worker that works with or other organizations in the community to be sure you have everything that you need to manage that condition for optimal,
There you
living.
go. So again, it's the team attack. And folks, if you have questions, reach out to your healthcare concierge at HealthTeam Advantage. The phone number 336-920-3648. That is a local number. And 2 websites to share with you, healthteamadvantage.com or HTANC.com. And John, we're talking about this chronic special needs plan, and it's for those dealing with a diagnosis of diabetes or congestive heart failure.
That's right.
All right. So eligibility, I'm guessing it's a little more than, hey, my doctor says I'm a diabetic.
Well, yeah, just a little more.
All right, so talk us through. What do we need to do? And
first of all, you have to be on Medicare, have Medicare Parts A and B already in place.
Got it.
Then once you have that, initially we're going to take your word for it that you've been diagnosed with diabetes or congestive heart failure.
Right.
Part of the application for this plan is providing us the physician's name that has given you that diagnosis.
All right.
We will then follow up with a phone call to that doctor's office just to verify that, yes, this person does have diabetes or congestive heart failure, and that's it.
Okay.
That is all that is necessary to qualify for this special needs plan.
And are there some geographical boundaries? Because we have certain counties where the HealthTeam Advantage that it's applicable.
That's right.
But what about this program?
So this program is available in 7 of our counties.
Okay.
It is available in Guilford, Alamance, Rockingham, Randolph, Forsyth, Davie, and Davidson counties.
That's really impressive that you do that. That's month after month. I can't tell you how impressive that is. So all right. So you need to be in touch with your doctor.
That's right.
And then you get in touch with HealthTeam Advantage, and we'll confirm the diagnosis, and you need to be a resident of one of these 7 counties, and with Medicare Parts A and B already in place.
That's right. That's all you need.
And then you can start to access the myriad of resources that are available.
Absolutely, and there are tons of resources available.
All right, and
this plan.
And there is no deadline for this.
No. This does not follow all of those enrollment periods that we've talked about on previous shows. You can actually enroll in this plan any month. So if you apply today, what's the day? April 8th. If you apply today, it will start May 1st.
Okay. First of the following month?
First of the following month.
All right. Now let's talk about some of the benefits, some of the advantages of this particular chronic special needs plan.
Okay. So just like our other plans at HealthTeam Advantage, this is a 0 premium plan, meaning you pay nothing per month in a premium to be on this particular plan. Okay. There is no medical deductible. You have a maximum out of pocket of $3,500 for a year. So worst case scenario,
right.
Something catastrophic happens, you would never have to pay more than $3,500 out of pocket for care. Okay. Now, along with that, we have a 0 copay for your primary care physician. We also have a 0 copay for your specialist that is treating your chronic condition. So if it's your endocrinologist for diabetes, right. your cardiologist for the congestive heart failure, podiatrists are a big one for diabetics.
Absolutely they are.
So that's a 0 copay
you can have
as
wound
well.
Care.
That's right.
Also, these are all part of your team that's going to help be sure that you are good to go day in and day out.
That's exactly right. We have a low hospital copay if you're admitted to the hospital. One thing that I haven't talked about, I don't think, on past shows with HealthTeam Advantage is we have a set copay for ambulance, whether it's a ground ambulance or an air ambulance. A lot of plans in our area will have a co-insurance for air ambulance, which could be astronomical. So we have fixed copays for both ground and air. Now, when we get outside of those kind of medical copays and expenses, our prescription drug coverage on this plan is exceptional. So the drugs that are used to treat your diabetes or congestive heart failure, we have a special Tier 6 for those. So your insulins are a 0 copay.
Okay.
Your drugs for treating your congestive heart failure, 0 copay. Tiers 1 and 2 are 0 copay. So we put a lot of effort into looking at the drugs that manage these conditions and keeping those costs extremely low or at 0.
Because sometimes, John, it can be daunting when you look at this drug registry, which can be pages, right? And you're trying to go through and find, well, where's what I take? And that's obviously can be resolved with a phone call to your healthcare concierge. Right. But for those that are dealing with diabetes, insulin's at the top of the list.
Top of the list, absolutely.
And everybody knows it.
Yes.
And so you don't have to go searching for it. You just enter into this thought process with the knowledge of, I don't have to worry about that. It's covered.
That's right.
Great.
Yep. That's how you go into it. Now, when we get outside of the medical and the prescription drug costs, we always look at dental. So you've got a great dental benefit under this plan, $3,000 per year that you can use towards preventive or your comprehensive dental care.
Sure.
You have vision coverage. Vision is big for diabetics.
So important for diabetics because your vision can change. Really? Wake up one morning and you see the world differently and you saw it last night.
Yep. So you got great vision coverage under this plan. If you need it, there's great hearing benefits for hearing aids. But then there's also the social aspect that we usually do talk about. And this plan has a little more built into it for these people with chronic special needs. Of course, we have our silver sneakers that gives you the gym memberships. Right. But then we have other things built in like transportation. We don't want people not to be able to make it to their regular doctor's office visits.
It's just as simple as I didn't have a ride.
Exactly. So we have transportation built into this plan. We have meals built in. So if you're admitted to the hospital, once you're discharged to come home, you can get 2 meals a day prepared for you, sent to your door, which is huge for people when they come home from a hospital stay.
Right. And so often we think, well, I'm out of the hospital, everything's good.
No.
You got to get back into the vibe, the ordinary rhythm of life. And that includes meal preparation. And there's just a lot of stuff that you don't have to deal with. And we want you to focus on getting well.
That's right. You may be well enough to come home from the hospital, but don't feel well enough to prepare meals.
Yeah, there's a lot of responsibility that comes with being at home.
That's right. So you've got the meals there. Then on top of that, we've got 2 additional services that help people at home. We have a custodial care benefit. So if you are coming home from the hospital, or even if you've had an outpatient procedure, you can initiate this custodial care, which will send people into your home to help you, with some of those daily living activities, cooking, bathing, those types of things. Because, like we said, you may be well enough to come home, but there's still you're not ready to do on your own yet.
It's a recuperation period.
That's right. Yeah. So there's help there for that. In today's society, we like to think, and we usually do have some family support, but families are busy working themselves.
And John, we're talking about this new chronic special needs plan, which is really not so new to our audience,
right?
Because we hadn't talked about it before, right. But been around for a while for folks that are dealing with the diagnosis of diabetes or congestive heart failure. And I said to you as we were going off the air for the last segment, so the out-of-pocket maximum.
Yes.
For the year, $3,500.
That's right.
Well, that is significant. That's not just that's something you need to think about, right?
You do, but I mean, the whole idea of insurance is protecting what you've worked for your whole life, and not completely bankrupt.
Right. So you got $3,500. We all appreciate that, right? That's a limit there. But then we went on to say a doctor could look at you and say, "Go get this test. Go have this exam. I need to admit you for 1 day to run this test." Your $3,500 is...
You're there before you know it.
Yeah, you're there, right?
With medical costs as they are today, yes, it does.
That out-of-pocket maximum is even more significant than some may realize when you talk about how much healthcare costs can skyrocket just on the turn of a note, right?
That's right, yes, because after that, your copays go away. The insurance company covers your costs for the rest of the year.
Sure, and I mean, what a relief. That you can get the care that you need.
That's exactly right.
To be where you are and you don't have to sit and worry about it. So we were talking about some of the benefits. We talked about eye care and expanded dental care. Then you got places, like if you're going to go to your cardiologist, your endocrinologist, your podiatrist, just so significant.
All zero copays.
And then the mental care, we kind of skipped over it just a little bit. That relationship, that connection that you're not in this alone.
That's right. That is so vital for every senior, but when you get into where you have these chronic special needs or these chronic conditions, that population even feels more isolated.
Yeah, and we don't want that.
No, we don't. And the mental health comes into play even more with that group of people, yes. So
you got silver sneakers, the gym membership, which we've talked about. Sure, you want to go walk laps.
That's right.
I mean, it's too, but that connection with other people that are where you are.
That is hard to quantify, but it is so important.
Yeah, absolutely it is. If your mental well-being, if you realize you're not alone, then you can fight on another day.
That's right. Which brings me to another great benefit that we have built into this plan, and it's a companionship service, Jeffrey.
Okay.
And there is no triggering event, such as a hospital stay or a procedure, to use the hours that we have set aside for companionship. We give every member 60 hours per year at a zero copay, where you can use a group called Papa Pals.
All right.
They will either come into your home or talk to you over the phone. They will take you grocery shopping, fold your laundry, take a walk with you, put a puzzle together. Just whatever you need to have some interaction with someone else.
So let's just say that family has taken on the responsibility of caring for this senior.
That's right.
That's not uncommon.
Right.
Families going out of town for the weekend. So they want somebody, can you check on mom or dad?
That's right.
Maybe Friday morning, Saturday afternoon, and that's where these hours are so important.
So
they can come
important.
into play.
Absolutely.
And also for the family, for your caregivers, you don't have that overwhelming sense of guilt. We shouldn't have come. We shouldn't have gone.
Right. Now I know they're cared for.
Yeah.
I'm free to leave town.
And really, what a release that is.
Oh, absolutely.
That's a safety net about 10 miles wide right there, brother.
You better believe it.
That's a big way.
And that's why we kind of built that into this plan, knowing, a chronic condition and the needs that come with that.
Sure. I mean, chronic, it's not ending.
That's right.
This is
That's
ongoing.
what that means. It's ongoing.
So let us help carry part of the burden. You got it the other 360 days of the year. Let us carry it for a little while.
That's right.
So that almost make me shed a tear. I get into that because it is the whole team. It's everybody at HealthTeam Advantage. It's the whole family to get you so that you're living your best life.
That's exactly right.
Every single day. All right. So that is the Chronic Special Needs Plan, your healthcare concierge, and we can revisit all of this with your healthcare concierge. They've got all your notes. They know who you are and where you're calling from anyway.
That's right. Would love to talk to you. Even if you just have a question, you're not, well, maybe that plan sounds like what I need, but you're not quite sure. Just give us the call. We'll walk you through it. We're not going to press you into anything. We will let you know the benefits that it would provide for you, and then it's up to you.
Because there are some other, you need some, maybe just as specific to your family about what's covered for hospital stays, if you have to go to skilled nursing. And for some folks, a lot of folks, you need that fill in the gap between the hospital and going home. So we had the skilled nursing facility.
We hit the skilled nursing.
And there is some coverage for that as well. And you can have all
right.
those conversations with your healthcare concierge.
Absolutely.
So you know what you're responsible for.
Yes.
Few things are scarier than going to the doctor and not knowing.
Not knowing. When you get out to the little desk, when you leave the office and you're trying to settle up and you don't want to be surprised at that point.
That can just almost make you sick all there by itself.
Yes.
So, it's a much better to know. And again, the website, HealthTeamAdvantage.com.
The one-stop shop for your healthcare needs.
Mm-hmm. I mean, folks, these are, and the folks, this is not, you're not calling out to Wichita.
No,
or
this
Lansing,
is local right here in the Triad.
Folks that live in your neighborhoods, drive the same streets, they know where you are and who you're talking about.
And they talk the way you talk.
That's right. Which cannot be underestimated.
No.
How frustrating is it when you encounter somebody and you don't understand them and they don't understand you?
At that point, I'm ready to wrap it up and move on somewhere else.
And the last thing we want is for you to be impatient and stressed out, and we're just trying to find out what your benefits are and what's available.
Right. That's what it's about.
Yeah, and your healthcare concierge, there's not a huge turnover here. So the same person you spoke with 6 months ago, still there.
Still there. You come on board with us, you get a magnetic card in the mail with a picture of your healthcare concierge. You just stick it on your refrigerator, and when you need them, they're there.
Sure. And the hours of availability?
Okay, so right now, starting April 1st all the way through the end of September, it will be Monday through Friday, 8 a.m. to 8 p.m.
Okay.
And then when we get into October through March, it's 8 a.m. to 8 p.m., 7 days a week.
And that's when we'll be back into enrollment period.
That's right.
It hurts to see, John, just a couple months, we'll be back in it.
I used to hear my grandparents talk about how quickly time passes, and now I'm experiencing it, Jeffrey.
Hey, you turn around twice, and all of a sudden, and it's time we'll be talking about enrollment deadlines.
We will be.
That opens the middle of October, right?
Yes, October 15th. We'll start talking about it. Our first session here on the radio in October. So,
and I was looking on the HealthTeamAdvantage.com website, and I saw a thing, and I thought, we absolutely need to have John explain this. You talk about getting your Medicare going.
Yes.
And then signing up. And we say, well, typically you got 3 months on either side of when you turn 65, right?
That's the typical, yeah.
So you say, all right, well, then I thought, does that mean, overthinking, does that mean 3 months from the day? And no, you have a 7-month period here.
You do. So it's not, it is the month of your birth. So 3 months before the month of your birth, 3 months after your birth month.
And so, you've got a 7-month period. That's your window that you need to make that happen. So if your birthday's in April, you could have done it January, February, March. You've got the rest of this month. You've got May, June, and July.
That's right.
To make that happen.
Yes.
All right, and the best way, that's really the first step. You got to get signed up for it, right?
That's right. You do that through Social Security Administration. You can do it over the phone with them. You can do it online, or you could make that trip in person to a local Social Security office.
Speaking of, now the Healthcare Concierge available again 8 to 8 Monday through Friday.
That's right.
336-920-3648, or you could head to 5815 Samet Drive in High Point.
That's right. We have a local center there where, our members can come. If you are, in this process of aging into Medicare, then stop by, see us. Everyone will tell you, just like I have here on the show, what steps you need to go through. They will walk you through it.
Sure. And the hours at the the local benefit center?
That's Monday through Friday, 9 a.m. to 4 p.m.
Okay. You need a reservation, an appointment?
You do not. Just pop in and see us.
And again, the number to call at HealthTeam Advantage, 336-920-3648, HealthTeamAdvantage.com.